I'm Dr. Padmakar. I'm a senior urologist working for Renova Century Hospital, Banjara Hills. Today we are discussing about the symptoms of benign enlargement of the prostate. A prostate enlargement is a natural phenomenon which occurs amongst the male, those who cross about 45 to 50 years of age. The symptoms are frequently passing urine, going to toilet very frequently. There is a sense of incomplete evacuation. Sometimes there is an urgency to go to toilet. Sometimes we also see these patients going very frequently at night. That is known as nocturnal frequency. Patients, especially those who have a very large prostate, they will have sometimes or urinary retention. That means he is unable to pass urine. There is bladder distension, lower abdominal pain, discomfort. These are all the symptoms which normally, some of them definitely will have some urinary tract infections because of the retention of urine. And retention of the urine also causes some kind of a stone disease, bladder infections, repeated infections, very rarely even kidney failure also. We have a wonderful treatment, very easy to diagnose. We can diagnose clinically when the patient comes to us in our OPD without any investigations. However, simple investigations like urinary examination, a blood urea creatinine, a blood test and a PSA test, which is a screening test for any cancer of the prostate. Ultrasound examination of the prostate is the key investigation for most of these cases. We can assess the size of the prostate, how much urine is retained inside, and what is the progress of the treatment. Presently, we have very good medication for this enlargement of the prostate symptoms. 90 to nearly 95% of the patients, they improve with medication. Medication once started will continue for at least 3 to 4 months. Reassess the patient with an ultrasound examination, and if there is any need, we should continue, especially during the winter time. The symptoms are very severe, so we need to continue these medication during the winter time. Medication has to be continued. Once we start it, it's continued for 6 months to 1 year. Later, if the size of the prostate is reduced and the patient is comfortable, then intermittently we can stop the medication and see how this patient behaves. Very rarely we operate on these patients only whenever there is a complication, like patient is unable to pass urine despite having started treatment for 3 months. The patient on catheter, that means urinary drainage. A patient who has a stone in the bladder, any other tumor in the bladder, these the patients have to be operated and follow it up accordingly.